Welcome back. The program is still Good Morning Abuja, and this morning we want to uh, put some light, or let me say, focus on a discussion that centers around substance abuse and addiction. Yes, we know we're in the festive season, and it's a time when people want to be merry and happy and cheerful. And of course, it's a time where people want to celebrate. But how far should we celebrate? How much should we expose ourselves to? This is what Dr. God knows Osare Hime will be discussing with us this morning on the program. Good morning and thank you for joining us on the show.
Good morning. Welcome to Good Morning Abuja. Good morning.
Yes, so substance abuse. This is a very big one, but
A wide
let's
one.
just let's get an overview from you.
Right. So substance abuse is actually classified as substance use disorder because there
Okay.
is a disease manual. It's called International Classification of Diseases, and then there
Okay.
is also the Diagnostic and Statistical Manual for Diseases. So
Okay.
it's classified as substance use disorder, and it's when a person uses either prescription drugs or non-prescription drugs beyond the way in which it's supposed to be used. Because
Okay.
even drugs that are legal can
Yes,
be abused.
abused.
All right.
Yes.
So
All
that
right.
is
That's the definition of substance abuse.
Yeah.
Can you outline those substances that most individuals abuse in the society?
Okay, in this society, most individuals tend to abuse alcohol, which is
Okay.
very common.
Okay.
Then they tend to abuse some non-prescription drugs such as marijuana and cocaine. Then some prescription drugs like opioids, which are actually prescribed for some specific illnesses, have also been noticed to be abused. Some of which we are familiar with, like tramadol, is actually an opioid,
Okay.
like codeine. Then there are some who are not so common in parlances like heroin. Heroin is not a non-prescription drug, but it is also one of the opioids that is being abused commonly. And then there is this trend that is being noticed of youths abusing some substances gotten from sock away pits and going maybe even premium spirits, like just sniffing it just to get a high. So there's some other drugs that the substances in them might not have been well studied, but there's also some other substances that are being abused now.
Okay. When we talk about substances and how it's been abused, one is one has to wonder why would you, like you said, some people sniffing things from latrine and toilets, and why would you push someone to that extent of wanting to
Yes.
engage in such?
Yes. So there are several things that push young, especially young people, especially, but there are the people of all ages abuse drugs. There are
Okay.
several things that push them into it. So for the young people, one common factor is mental health disorders. Some youths have some mental health disorders like depression. It might be undiagnosed, but some are depressed, some are having anxiety, some might have passed through some form of physical, emotional, or even sexual abuse. And then, in a bid to heal, some of them confide in some people who wrongly advise them that, oh, this would calm you down. You will feel good after taking this. And then they go into it. And then there's also some people are introduced into it at a young age because family members, especially older family members who they look up to, are into all this. And, as children, they tend to imitate what
What you
they
see.
see around, and then
Okay.
they are lured into it. And then there's also peer pressure. Like sometimes you hear of. I remember when I was in secondary school, and then some of my classmates are talking about, oh, have you drunk alcohol or something? And they're talking about things. If you're someone that wants to fit in, you want to feel like a cool person. You want to also do that just to fit in with your friends, especially if you are in that circle. And so these are some of the factors that push one
That push
into
one
it.
into
Yes.
it. From analysis, it has to affect the mental health of the individual taking it. So, what other medical effects do they have?
Yes. So beyond the mental health effects, substances are actually very toxic to the liver. So you might be familiar with people coming down with liver issues, and usually they have jaundice, their eyes are yellow, their urine, and all that. These substances are actually toxic to the liver, and they're also toxic to the kidney. We've seen, especially in the hospital, before, like years ago, you tend to see kidney disease in older people, like 40s, 50s. But now you see like 20 something. I remember I've seen quite a number of patients, young, like around my age, and then they're having kidney diseases. And it's because of this substance use that affects their kidneys. Then it also affects fertility because people
Okay.
that use substances, they usually tend to have, even if they stop, that effect, that accumulation that has gone on the
Go
body,
on the
it can
body.
actually affect fertility later in life if they decide, okay, they want to have children. So these are just some of the physical effects that it can have. It also affects other systems because a lot of times these substances, they are taken in quantities that the body cannot handle because the body has a normal mechanism by which it detoxify substances. Even some foods, even drugs that we actually, all drugs are poisons anyway. But some
Yes.
drugs that we take, we have our liver helps to like detoxify it, make it
Mm.
harmless, and then you pass it out in the urine of it. But they take all
Okay.
these things that the body cannot handle, and then sometimes they now accumulate, they get stored in organs, and then over the long term, they now cause some
Oh,
physical
okay.
issues in addition to the mental issues that
Okay.
causes.
Okay. Let's talk about regulations now. What we think with the trend now that people
Mm.
are abusing substances and everything, and of course, this is not taking it away from the national Nigerian Drug
Drugs.
Law
Yes.
Enforcement
Yes.
Agency. They are
Yes.
doing a wonderful
Mm.
job so far as busting drug
Oh.
syndicates are concerned. But from the medical perspective, um, how much effort do you guys put into not just uh, treating the patients, but
But
trying to
Coven.
prevent it?
Mm.
Yes. Okay, so what we can do, I would like to first of all commend the Nigerian government because I there's something I noticed when I was doing my housemanship in Lagos.
Mhm.
I noticed that when we send, there are some drugs that they are called opioids, but
Mm.
we sometimes prescribe them to people that have very severe pain. I noticed that whenever we
Mm.
prescribe it and they have to go out elsewhere to buy it, they always sometimes come back and say, we have to write the address, write phone number because there's some form of regulation and it's
Okay.
which is very commendable because those drugs are drugs that if the patient gets hooked to them and it's very easy to buy, they will just go and be buying it. So I want to
Mm.
commend them for that. So what
Okay.
we do now, a drug like that, I'll speak on the opioids. A drug like
Yes.
that is it's susceptible to abuse. We tend to give it in controlled doses and we tend to give it for a short while. So maybe someone has had a surgical procedure that was very extensive, and we know that of course we have to give these opioids, even though it is something that people can abuse. We have to give it in some instances. We tend to give it for just a short while, and then we taper. We do what's called we taper down. So we
Mhm.
give the opioids. We now give some. We start with a strong opioid. We go to lesser opioids. We reduce it, and then we now go to non-opioids. So that
Okay.
tapering down and giving it for a short while, it helps them not to get hooked to the drug. So that's
Drugs. Okay.
one thing we do. And
Okay.
then there are some drugs like tramadol that used to be, it's not prescribed as much again because we
Okay.
noticed that. So that's one thing.
Mm.
Then like codeine, which is actually supposed to be seen in cough syrup, that we noticed people
Yeah.
started, yes, some things like that. We've tried to reduce the way we try to limit the number of conditions we prescribe some of
Drugs.
those drugs. So I think
Drugs.
that is what we're doing in terms of prevention.
Those who indulge in the substance, how do you take care of them medically?
Yes. So the first step in treatment is that the person actually has to want the treatment because that actually helps us. So
Okay.
they present to the hospital. Now, substance use is classified as a psychiatric problem. So once
Okay.
they are seen by like the general doctor usually refers them to a
Okay.
psychiatrist.
Okay.
So the psychiatrist would see them, and there are different types of therapy. There is usually most of the therapy is like behavioral therapy,
Okay.
and it's not going to be it's a long term thing. It's going to take
Wow.
a while. Yes, so they would have to be for some of them, for most of them, they had to like be admitted, they had to be there, monitored over a while. So there are different the mode of approach actually depends on the type of drug. There's some type of drugs that people have used that while we're treating, what they do is that they still give them those drugs, but they begin to reduce it gradually because if you just stop it immediately, it has some effects on the body because the
Okay.
body is already used to those
Yeah.
drugs. So there's some
Okay.
effects. So
Right.
usually there's something that they will be tapered while they are also offering behavioral therapy. And family support is very essential. The family has to sometimes come around and just leaving them on their own with other people can
People.
be yes. Then there are also support groups. But support groups are becoming a thing now in Nigeria. It's
Mhm.
actually like an American thing. So you
Mhm.
have support groups like Alcoholics Anonymous and all, where it's a group made up of people that have come out of that form of
Those. Okay.
addiction and then people that are trying to come out of it. So they meet, they discuss because as a doctor, yes,
Yeah.
you have like the knowledge and you have the
Mm.
skills, but there are some things that it can actually there's actually some benefit in interacting with someone who has gone through
Gone
the
through
same
it.
thing.
Yes.
Yeah, so that's the benefit. That's like the advantage
Okay.
of support groups, having
Okay.
those people. So support groups and therapy. Support groups and therapy. Those are the major ways. But the person also has, because there are stories of where maybe a parent feels like, oh, this child is abusing substance, and then they just bundle the child to
Right.
therapy, which I understand, yes. But the child has to, first of all, they have to get to a stage where the person actually wants treatment. Because sometimes they will go through the rehab and everything, and then they will come back and go back to it because they never got to that. They have to get to that stage
Accepting to
that
leave.
yes, I'm
Okay.
okay, I'm done with this now. I have
Wow.
to. And then it's not going to be easy. There will be times where they might fall back to it. It's going to
Mm.
be, and they need support. Not maybe they've come back from rehab and they're at home, and then they just sometimes the parents are like,
Mm.
that's why you started abusing some,
Yes.
things like that. So they need that
That
emotional
love.
support too.
Yes.
Yes, so those are the.
All right. As a medical practitioner, what advice will you give those who indulge in this?
So for those who indulge in it, I would
Uh-huh.
like them to be aware of the effects,
Okay.
because they might get some pleasurable effects, which I'm not going to take away from. Yes, they might have some pleasure, but I like them to know about the effects, because the effects of these substances, apart from the effect on their mental health, the effect on their physical health, it also affects their relationships. And it's before, it used to be a thing where substances were abused. There used to be this gender gap, this wide gender gap, like it's
Mm.
more of men. But now the gap is
The God.
closing in.
Yes.
You see, even married women that
Mm-hmm.
you would think, oh, okay, she's supposed to be responsible of
Yes.
using substances. So it affects their relationships, because those kind of people are likely to abuse their children
Wow.
physically, emotionally, to neglect their children. Even a man that is abusing drugs, that is married is likely to affect his relationships, maybe with his wife, with his parents. Is likely to make the person have issues with the law, get involved in crime. Because the
Uh-huh.
thing about addiction is that these drugs are not too cheap. So and they also affect your attitude to work. So this person is more likely to lose his job. And then they're already addicted. So they will do anything
Anything.
to get those drugs. They would get involved in crime. They would do anything to get it. So it affects them, it affects their relationships, it affects their physical health, as I mentioned, the liver, the kidney, and some other organs. It affects their mental health. There's this interrelationship between substance use disorder and mental health, because the people that have mental health disorders, they can be predisposed to getting addicted because they feel like it's going to help them. And then people that use substances are likely to also have mental health. So there is this interrelationship
Shit.
between them. So those are, I would like them to know about that. And that the fact that that little benefit that you think you are getting, the risks are in the short term and the long term would actually outweigh those
Yeah.
benefits.
That means self-medication is abusing
Yes,
drugs.
I don't know if doctor would agree with me. I think when you do not even take, that is when you take the drug and you're not taking it at the proper dosage, not just above now. If you're supposed to take two Panadol
And you're
or two
taking
tablets
six.
of paracetamol and you take one, it's still substance abuse, right?
Abuse,
No, no,
definitely.
no.
It's
It's
not
not
substance
substance
abuse.
No, no,
abuse.
no, no, no.
Okay.
Taking less just
Less
means that
below
it's
it.
not going to work as it should.
Exactly.
So
Okay, so it,
that's
it has no effects.
no, it doesn't have any effect. It's just that the person will probably not feel well because they're not taking up to the required dose. But substance
Okay,
abuse is when you're taking
taking
beyond
over
what.
beyond.
All right, we
Yes,
Wow.
you're
needed to
supposed
get
to.
that clarified,
Right.
and that is why I asked that question.
Question.
Doctor, God knows it's
The
been a pleasure
pleasure of
having
speaking
you
with
Thank
you.
you.
here in the studio
And
talking about substance abuse and addiction. Yes, Amina, do you have any
substance
final words
abuse.
for doctor or you?
I don't have any final. She has said everything.
All right,
The ill associated to this, it's horrible. We need to just stop it. No to drugs.
all right,
No, no, no to drugs.
all right.
Okay.
Not
All
no to
right.
drugs, no to drug abuse.
Yeah, so
Yes.